नमस्कार। हल्लै हल्ला अनि भिडले भरिएको संसारमा एउटा सुनसान आवाज, एउटा शून्यता अनि प्रश्न, हाम्रो भोलिको सन्तानहरू कहाँ छन्? आज हामी अति नै इम्पोर्टेन्ट डिस्कसन लिएर तपाईहरुमाझ उपस्थित भएका छौँ। के तपाईहरुलाई थाहा छ सिक्किमको जनसङ्ख्या दर अथवा सरल भाषामा भन्न पर्दाखेरि सिक्किमको जुन मूल रैथानेहरूको जनसङ्ख्या छ यो घट्दै जाँदैछ। अनि तपाईहरुलाई म जानकारीमा ल्याउन चाहन्छु, विशेष त हामी यसलाई टोटल फर्टिलिटी रेट भनेर भन्ने गर्दछौँ अनि व्यापक चर्चा परिचर्चा यसभन्दा अघि पनि भइसकेको छ र भनिन्छ कि अबको लगभग 30-40 वर्ष बाद यदि यो प्रब्लमलाई हामीले सल्भ गर्न सक्षम भएन भने सिक्किमको मूल रैथानेको कुनै पनि अस्तित्व हुने छैन। अनि यो एउटा डेमोग्राफिक प्रब्लम मात्र होइन, तर यो एउटा सोसियो इकोनोमिक अनि कल्चरल प्रब्लम पनि हो। जब जनसङ्ख्या नै रहँदैन भने कुनै भाषा पनि रहने छैन, कुनै संस्कृति रहने छैन, कुनै पनि आफ्नो जति पनि ट्रेडिसनल कुराहरू छ यो रहने छैन। र कतिको हामी सिरियस छौँ सिक्किमवासीहरू यो हामीले चिन्तन मनन गर्न अति नै आवश्यक छ। हामीलाई थाहा छ कि 50 वर्षको जुन स्टेटहुड हामीले पालन गरिरहेका छौँ, भर्खरै पाल्जे स्टेडियममा सिक्किमे रैथानेका मानिसहरू धेरै जम्मा भएको थियो यो सेलिब्रेट गर्नका निम्ति। तर 100 वर्षको स्टेटहुड सेलिब्रेसनमा के सेलिब्रेट गर्नका निम्ति हाम्रो सिक्किमेहरू, मूलवासीहरू, रैथानेहरू हुनेछन्, यो एउटा ठुलो प्रश्न छ। र यसैबारे विचार विमर्श गर्नका निम्ति आज हामी समक्ष केही प्यानलिस्टहरू हुनुहुन्छ अनि सिक्किम इन्स्पायर्ससँग मिलेर हामी यो कार्यक्रमलाई तपाईहरुमाझ ल्याइरहेका छौँ र उहाँहरूको विचारधारा सुन्नेछौँ। अनि धेरै काम पनि सुरु भइसकेको छ यो टिएफआरलाई कम्ब्याट अनि एड्रेस गर्नका निम्ति। र म क्रमैले आजको प्यानलिस्टहरूको परिचय राख्न लागिरहेको छु अनि त्यस सँगसँगै उहाँहरूसँग हामी कुराकानी पनि गर्नेछौँ। सर्वप्रथम हामीसँग हुनुहुन्छ प्रिन्सिपल डाइरेक्टर एन्ड एडिसनल मेडिकल सुप्रिन्टेन्डेन्ट अफ एसटिएनएम अस्पताल सोकेगाङ, जो टिएफआर को इनफ्याक्ट उहाँ नोडल अफिसर पनि हुनुहुन्छ, डाक्टर सुरेश मदन रसाइली। तपाईँलाई म स्वागत गर्न चाहन्छु। हामीसँग हुनुहुन्छ एडिसनल सेक्रेटरी प्लानिङ डिपार्टमेन्ट, जो चाहिँ प्रोजेक्ट डिरेक्टर पनि हुनुहुन्छ सिक्किम इन्स्पायर्स प्रोग्रामको प्लानिङ डिपार्टमेन्टको अन्डरमा, म्याडम रोहिणी प्रधान। हामीसँग हुनुहुन्छ डाक्टर रुचि छेत्री र उहाँ विशेष त फर्टिलिटी अनि आइभीएफ एक्सपर्ट हुनुहुन्छ अनि गाइनोकोलोजिस्ट पनि हुनुहुन्छ। र हामीसँग हुनुहुन्छ डाक्टर सन्ध्या थापा। डाक्टर सन्ध्या थापा प्रोफेसर हुनुहुन्छ सोसियोलोजी डिपार्टमेन्ट सिक्किम विश्वविद्यालयबाट। र हामीसँग हुनुहुन्छ डाक्टर नितिश मण्डल अनि उहाँ एन्थ्रोपोलोजी डिपार्टमेन्टबाट हुनुहुन्छ सिक्किम युनिभर्सिटी। म हाम्रो 5 जना प्यानलिस्टलाई म स्वागत गर्न चाहन्छु। सुरु म गर्न चाहन्छु रोहिणी प्रधान म्यामसँग। तपाईँलाई म सोध्न चाहन्छु कि हाम्रोमा कुनै पनि एउटा एक्सटेन्सिभ लिट्रेचर छैन, कुनै पनि एउटा कङ्क्रिट डेटा छैन अनि जुन टोटल फर्टिलिटी रेटको कुरा हामी गर्दछौँ होइन, यसलाई अति सरल भाषामा तपाईँले बुझाइदिनुहुन्छ। अनि विशेष म सोध्न चाहन्छु कि सिक्किम इन्स्पायर्स कार्यक्रमले चाहिँ कसरी तपाईँहरूले विशेष यो डिक्लाइनिङ फर्टिलिटी रेटलाई चाहिँ एड्रेस गर्नुहुँदैछ?
थ्याङ्क यू। एकदमै सरल भाषामा भन्नुपर्दा सिक्किम इन्स्पायर्स एउटा गभर्मेन्ट अफ सिक्किमको सोसल सस्टेनेबिलिटीमा एउटा फ्ल्यागसिप प्रोग्राम हो, जो अहिले इयर 1 भर्खरै मात्रै कम्प्लिट गरेर इयर 2 अफ इम्प्लिमेन्टेसनमा छ। अनि यो प्रोग्राम एउटा इकोनोमिक इन्क्लुजन प्रोग्राम हो फर वुमेन एन्ड युथ इन नन फार्म सेक्टर्स है। अनि यो प्रोग्राममा हाम्रो प्लानिङ एन्ड डेभलपमेन्ट डिपार्टमेन्टले एङ्कर गरिरहेको छ सबै इन्टरभेन्सन्स अनि एक्टिभिटिजहरूलाई। अनि यसको हाम्रो 8वटा अरू इम्प्लिमेन्टिङ डिपार्टमेन्ट्सहरू छन्, जुन चाहिँ डिपार्टमेन्टको रोल चाहिँ फर इकोनोमिक इन्क्लुजन एक्टिभिटिज चाहिँ इम्पोर्टेन्ट हुन जान्छ, जस्तै स्किल्स डेभलपमेन्ट डिपार्टमेन्ट, कमर्स एन्ड इन्डस्ट्रिज। यसै गरेर धेरै डिपार्टमेन्टको माझमा हाम्रो हेल्थ एन्ड फ्यामिली वेलफेयर डिपार्टमेन्ट इज अल्सो वान अफ द इम्पोर्टेन्ट डिपार्टमेन्ट्स अन्डर सिक्किम इन्स्पायर्स। अनि हेल्थ एन्ड फ्यामिली वेलफेयर डिपार्टमेन्टमा चाहिँ हाम्रो 2टा मेजर इन्टरभेन्सन्स छ इन्स्पायर्सको अन्डरमा। एउटा इज अन तपाईँको मेन्टल हेल्थ। तपाईँहरूलाई यादै छ यो भर्खरै हाम्रो स्टेट डे सेलिब्रेट हुँदाखेरि फर्स्ट इन्टिग्रेटेड मेन्टल हेल्थ स्ट्राटेजी एन्ड सुसाइड प्रिभेन्सन स्ट्राटेजी हाम्रो लन्च पनि भएको थियो, यो पनि सिक्किम इन्स्पायर्स प्रोग्रामकै अन्डरमा। अनि यसरी नै अर्को इन्टरभेन्सन चाहिँ हाम्रो रिप्रोडक्टिभ हेल्थको अन्डरमा छ है। यो रिप्रोडक्टिभ हेल्थको अन्डरको इन्टरभेन्सनमा चाहिँ एड्रेसिङ ग्रेभ डेमोग्राफिक क्राइसिस द्याट सिक्किम इज फेसिङ राइट नाउ, टिएफआर को यसलाई एड्रेस गर्नुको लागि चाहिँ सिक्किम इन्स्पायर्सको अन्तर्गतमा धेरैवटा कार्यक्रम अनि एक्टिभिटिजहरू भइरहेको छ। अनि एउटा कन्टेक्स्ट सेट गर्नुपर्दाखेरि चाहिँ सिक्किमको जुन चाहिँ यो जनसङ्ख्यामा जुन चाहिँ डिक्लाइन आउँदैछ त्यो चाहिँ एकदमै स्टिप रहेको छ। अब 1 डिकेडको अन्तरालमा यो पर्सेन्टेज भन्नुपर्दाखेरि चाहिँ अलमोस्ट 129%ले चाहिँ सिक्किमको टिएफआर घट्दै गएको छ। जुन चाहिँ 1998-99 को एनएफएचएस डेटा अनुसार 2.75 हाम्रो टिएफआरको जुन चाहिँ दर थियो भने यो चाहिँ 1.1 रेकर्ड भएको छ एनएफएचएस 5 2019-21 को रिपोर्टमा। सो यो स्टिप डेमोग्राफिक डिपले चाहिँ के बुझाउँछ भन्दाखेरि चाहिँ अब फ्युचरमा लाइक यु मेन्सन्ड अर्लियर 50 इयर्स सेलिब्रेसन हामी यतिजना मिलेर रमाएर गरिरहेको छौँ भने सायदै यही दरले हाम्रो जनसङ्ख्या घट्दै गयो भने चाहिँ 100 इयर्स अफ स्टेटहुड सेलिब्रेसनमा धेरै कम्ती सिक्किमेलीहरू मात्र रहनेछन्। सो यसको लागि चाहिँ गभर्मेन्ट अफ सिक्किमले एउटा होल अफ गभर्मेन्ट अप्रोच लिएर अन्डर सिक्किम इन्स्पायर्स धेरैवटा कन्सर्टेड एन्ड कन्सियसली एफर्टहरू लिइरहेको छ है। अनि सिक्किम इन्स्पायर्स आउनुभन्दा अगाडि पनि हामी सबैलाई यादै छ गभर्मेन्ट अफ सिक्किम मलाई लाग्छ कि हाम्रो इन्डियामा नै एउटा वान अफ द फर्स्ट स्टेट नै होला यस्तो फरवर्ड लुकिङ स्किम्स लाइक वत्सल्य, हाम्रो मटर्निटी लिभ बेनिफिट फर गभर्मेन्ट इम्प्लोइज है, एडभान्स इन्क्रिमेन्ट फर ह्याभिङ सेकेन्ड एन्ड थर्ड बेबी, यस्तो खालके प्रोग्रामहरू त गभर्मेन्ट अफ सिक्किमले गरि नै रहेको थियो। तर अझै यसलाई एभिडेन्स बेस्ड साइन्टिफिक वेमा अगाडि लानुको लागि अनि टिएफआर जुन चाहिँ जनसङ्ख्यामा जुन चाहिँ डिक्लाइन आउँदैछ यो एउटा क्लिनिकल के भन्नु इस्यु मात्रै होइन, यसलाई एड्रेस गर्नुको लागि हामीले सोसियली इकोनोमिकली अरू वेजमा पनि धेरै प्रकारले धेरैवटा इन्टरभेन्सन्सहरू ल्याउनु पर्ने हुन्छ गभर्मेन्टले। सो यसै प्रकारले एउटा होल अफ गभर्मेन्ट अप्रोच लिएर एउटा साइन्टिफिक वेमा एभिडेन्स बेस्ड डेटा ब्याक्ड प्रोग्राम्स अनि पोलिसिजहरू ल्याउनुको लागि चाहिँ सिक्किम इन्स्पायर्सले धेरैवटा एक्टिभिटिज एन्ड इन्टरभेन्सन्सहरू लिएर आइरहेको छ।
हजुर, म डाक्टर सुरेश मदन रसाइलीकोमा आउन चाहन्छु। डाक्टर, हामीले जान्नमा आयौँ कि एसटिएनएम अस्पतालमा विशेषतः एउटा टेक्नोलोजी सुरु हुँदैछ, यसलाई चाहिँ एसिस्टेड रिप्रोडक्टिभ टेक्नोलोजी एआरटी भनेर सर्ट फर्ममा भनिँदो रहेछ। अलिकति बुझाइदिनु हुने, किनभने एसटिएनएम अस्पताल एउटा सरकारी अस्पताल हो अनि जति पनि यहाँ आउने उपचार गर्ने पेसेन्टहरू हुनुहुन्छ एकदम निम्न स्तरबाट आउने गर्दछ र एउटा सरल भाषामा यो एआरटीले चाहिँ टिएफआरलाई मतलब बढावा दिनमा कतिको सहयोग गर्छ अनि कसरी गर्छ?
एआरटी सेन्टर अघि म्यामले भन्नुभएको जस्तै इट इज जस्ट एन इन्टरभेन्सन इन द प्रोसेस अफ करेक्टिङ अर इन्क्रिजिङ द फर्टिलिटी ट्रेन्ड्स इन सिक्किम।
हजुर
है, त्यसमा लाइक एसटिएनएमलाई चाहिँ हामीले किन उयो गऱ्यौँ भन्दाखेरि इट इज अ टर्सरी केयर लेभल हस्पिटल हो। अल सबै स्पेसियालिटीहरू प्रायः जस्तो छ, सबै इन्भेस्टिगेसन्सहरू पनि प्रायः जस्तो हुँदैछ। अनि एसटिएनएममा गर्दा चाहिँ हाम्रो अब सरकारी पोलिसीले गर्दा जुन रेट हुन्छ ट्रिट गर्ने इट विल बी एकदमै कम्ती हुन्छ। जो बाहिर अहिले बाहिर सुन्यो भने मान्छेहरूले घर बेचेको, जमिन बेचेको, अब सरकारले त सहायता गर्नु हुँदैछ तर अब त्यसले पनि नपुगेर उहाँहरूले आफ्नो धन सम्पत्ति बेचेर त्यो नानीलाई उयो गर्नुको लागि कोसिस गर्दैछ। हामीले एसटिएनएममा लेभल 8 मा अबाउट 5000 स्क्वायर फिट एन्ड मोर स्पेस राखेको छौँ, जसमा कि प्राइभेसी, एउटा प्राइभेसी चाहिँ ठुलो कुरा थियो, जसमा हस्बेन्ड वाइफलाई प्राइभेसी होस् है, एक्सपोज नहोस् भनेर त्यहाँनिर अल्ट्रा मोडर्न आर्ट सेन्टर विच विल डिल विथ लेभल 1 एन्ड लेभल 2 इन्टरभेन्सन गरेर के अरे प्रेग्नेन्सीहरू इन्ड्युस गराउने। एन्ड वी अलरेडी ह्याभ भेरी गुड एक्सपर्ट्स छ जो अभाइलेबल छ, हस्पिटलमा छ, प्राइभेटमा छ। एन्ड आई थिङ्क बाई एन्ड अफ फिनिसिङ द 50 years of statehood celebration यति एउटा आशा राख्छु कि हामीले आर्ट सेन्टर चाहिँ तयार गरेर लन्च गरेर देन मेक इट फङ्सनिङ। त्यो चाहिँ एउटा हामी सबैको एउटा लक्ष्य हुनु पऱ्यो, एउटा के भन्छ एउटा ड्रिम हुन्छ। हाम्रो ड्रिम चाहिँ त्यही छ कि बिफोर दिस इयर 50 years फिनिसेस हामीलाई चाहिँ हाम्रो आर्ट सेन्टर तयारी गर्छौँ।
राइट। डाक्टर सन्ध्या, तपाईँकोमा आउन चाहन्छु म है। तपाईँले स्टडी गर्नुभएको छ फर लास्ट लाइक 2 इयर्स है, विशेष तपाईँको इन्टरभेन्सन अथवा स्टडीमा थियो कि किन चाहिँ के भन्छ एलिमेन्ट्री लेभलमा स्पेसली आँगनबाडी स्कुल्सहरूमा चाहिँ ड्रप आउट हुँदैछ अथवा नानीहरू कम्ती हुँदैछ भनेर है, यसमा टिएफआरलाई कसरी हामी संलग्न गर्न चाहन्छौँ अनि तपाईँको स्टडीको फाइन्डिङ्स के थियो स्पेसली?
Thank you, Nirmal sir. Especially the study which we have done, declining number of the Anganwadi beneficiaries, त्यसमा we did, like we collected, हामीले थुप्रो quantitative dataहरू हामीले collect गर्यौँ. त्यसमा family size if you see, जुन चाहिँ एकदमै collaborate हुन्छ with the NFHS data. हाम्रोमा almost 87%, more than 50% have the single child, and the दुईटा गर्दाखेरि चाहिँ almost 87%. It was more than 987 sample. Sir? So त्यहाँबाट एउटा generalization आयो, small family size is one of the main cause. अनि यसलाई हामीले quantitative data मा पाइसकेपछि चाहिँ we conducted focus group discussion in the 13 project in the different districts of Sikkim. So first मा गएर when we asked कि तपाईहरुकोमा आँगनबाडी beneficiaries मा किन कम्ती छ, the first response was, ma'am, there are no children in our village. नानी नै छैन, and whatever small little children they have, they are sending it to the government, private schools. अब नानी किन छैन? So हाम्रो entire discussion used to revolve around कि why there are no children. So त्यसमा हामीले हेर्दाखेरि चाहिँ हामीले देख्यो एक त small family children, अनि we even interacted very in-depth interview with the say educated groups, those who have a very stable income, अनि जसको चाहिँ छैन, हार्ड अब लेबररहरू हुनुहुन्छ, कार्पेन्टर्सहरूको वाइफ हुनुहुन्छ, उहाँहरूसँग हामीले इन्डिभिजुअली उहाँहरूको इनडेप्थ इन्टरभ्यू गरेर सोध्यौँ कि तपाईँहरू बेसी नानी किन चाहनु हुँदैन. सो देयर इमिडिएट आन्सर वाज, म्याम द रिच, आई मिन दो हायर क्लासमा जति पनि हाई क्लासको छ, दे हेभ नट इभन 2 नाउ, दे हेभ, आई मिन द आइडियल फ्यामिली साइज इज 1. त हामी त अलरेडी वी आर पुवर, त वाइ सुड वी हेभ बी मोर हैन. अनि हाम्रो पनि we also have a dream of sending our children to the good school, and educational cost is very high, and moreover अर्को कुरो चाहिँ मैले के देखेँ भने नि, most of the whether in the government sector or whether in the private sector, women are working now. त्यो जुन चाहिँ हाम्रो traditional gender norms थियो कि man is a owner, women is a homemaker, somehow that has been, that stereotype now I think has been broken. So women are also equally earning, women are also equally participating in the economic, have the economic participation, and having more children is also intervening their career also. Especially educated, they say, no, my career will be like, it will be affected, then we'll take care of the children. That is one, sir. And why you don't want to have more children, Manda? कसले हेरिदिन्छ. सो यो वाइडर स्ट्रक्चरल चेन्जसँग चाहिँ यति बिग्न लाइक पायो हामीले रिलेटेड, बिकज वेन वी सी द एनएफएसएस डेटा अल्सो द न्युक्लियराइजेसन ट्रेन्ड इज गोइङ इन अ बिग वे. डिसइन्टिग्रेसन अफ द जोइन्ट फ्यामिली and the nuclearization, which we also found even in the empirical situation.
न्युक्लियराइजेसन भनेको चाहिँ छुट्टेर जोइन्ट फ्यामिलीबाट छुट्टेर आमा बाउसँग छुट्टेर अलग्गै सिंगल
बस्छ, अन्त नानी कसले हेर्दिने. Okay, and so these was like also one of the most important structural change सँग चाहिँ wider society मा जुन परिवर्तन आउँदैछ त्यसले गर्दाखेरि पनि एउटा न्युक्लियराइजेसन्सको भएको छ है. अनि अर्को कुरा हामीले थुप्रो जाँदा द ट्रेन्ड अफ हाम्रो फाइन्डिङमा चाहिँ सिजरियन मोड अफ डेलिभरी, नो द लाइक इभन इन द रुरल जङ्गुमा हामी गयो है, अब त्यति बेसी मेडिकल फेसिलिटिज छैन. जब हामीले त्यो फोकस ग्रुप डिस्कसन कम्प्राइजिङ अलमोस्ट 30-40 पिपल गाउँमा है, नट ओन्ली एजुकेटेड बट अल्सो दोज हु आर वर्किङ इन द लोवर लेभल, उहाँहरूको के अब त्यो पेन कसले सहने, अब ओके पेन कसले सहने, त इजिएस्ट मोड इज द सिजरियन सेक्सन. एन्ड उहाँ एकजना हामीलाई आशा वर्कर्सले भन्नुभएको थियो, अन्त वेदर वेन यु अप्ट फर द सिजरियन सेक्सन, mode of delivery cesarean sections हुँदा चाहिँ then 1 or 2 maximum, then they limit the things. There are a number of the other factors, sir. Maybe in course of discussion I can elaborate more
So
on that.
एउटा कुरो यहाँनिर म के ल्याउन चाहन्छु भन्दाखेरि चाहिँ आई थिङ्क गभर्मेन्टले पनि रेन्ज अफ इन्सेन्टिभ्सहरू आई थिङ्क इन्ट्रोड्युस गरेको छ, जस्तै अब स्यालेरी इन्क्रिमेन्ट फर गभर्मेन्ट इम्प्लोइज ह्याभिङ 2 or more चिल्ड्रेन छ होइन अन प्लेस, अनि मटर्निटी पटर्निटी लिभ, अनि अहिले चाइल्ड केयर लिभ भनेर भनेको छ होइन नोमेनक्लेचर। अनि इम्पोर्टेन्ट चाहिँ छ 2022मा वत्सल्य स्किम अन्तर्गत चाहिँ जो नानी नभएको दम्पति छ उहाँहरूलाई चाहिँ 3-3 लाख ट्रिटमेन्टको निम्ति दिने गर्दछ। अनि अरू त थुप्रो अब फ्याक्टर्सहरू जस्तै क्रेसहरू खोल्ने पनि कुरोहरू चलिरहेको छ। लेट मी कम टु डक्टर रुचि छेत्री है, तपाईँ किनभने अब स्पेसली टेक्निकली इन्भल्भ हुनुहुन्छ नि फर्टिलिटी र आइभीएफ ट्रिटमेन्टमा, नि अलिकति हामीलाई बुझाइदिनु हुने कि कस्तो कस्तो खालको कपलहरू तपाईँकोमा आउँछ एन्ड यु नो कस्तो प्रोसेस इन्भल्भ हुन्छ फर्टिलिटी र यो आइभीएफ ट्रिटमेन्टमा?
मैले इट्स बिन 2 वर्ष भयो मैले मेरो आफ्नो प्राइभेट ओन्ली माइसेल्फ जो यो गरेको है। वाट आई फाउन्ड इज सिक्किममा मोस्ट अफ द पेसेन्ट्स हु कम टु सिक हेल्प मेरोमा जबसम्म आउनुहुन्छ दे आर लेट्स से 90% above 35 years of age है। Now when we talk about 35 years of age, this 35 is very important because there are so many studies, surveys, whatever, it's been proven in our field that after 35 years say the number of eggs of a woman, like we all know that a woman is born with a limited number of eggs, right? Which every month gets utilized one by one, sort of, you know? So they have a certain, that's why we have menopause, sort of, like, right? So अब हाम्रो मान्यता यो छ कि 35 इयर्सको बादमा चाहिँ एग घट्दै जान्छ भनेर। बट वेन वी लुक एट आवर इन्डियन सिनारियो टेक्निकली अब हाम्रो उसमा छ सर्वेजमा कि हाम्रो इन्डियन वुमेन वी एज 5 times before the Caucasian women. Maybe it is the food nutrition because they have very high level of standards that they maintain and all that, you know? Or there are other number of factors, let's not go into that. But this 35 जुन चाहिँ भन्छ नि, so what it means is that by the time a woman is coming to seek help actually for fertility, sub-fertility, they are already beyond that time limit. That's why हामीले तपाईहरु youngstersहरुलाई त्यही भनेको, the awareness has to start from the younger level, you know, because everything you are doing just now is going to affect your fertility, both men and women, later on. That includes your lifestyle, your food habits, smoking, alcohol, right? Because a lot of young women are having PCO problem. And Sikkim, what I found, I'll just add, tapeko question, but a slightly deviate gareko. One very important thing is safe sex is very important, right? Illegal abortions or unsafe abortion practices, that should stop, because we also maybe as doctors, as a society, we should provide a safe, place for that, because then they tend to go and seek help elsewhere, end up with infections, which leads to your tubal blockage or endometritis, that is infection of the uterine lining, which will later on cause infertility for you, right? So it has to start from the very basic level, starting from your food habits, your lifestyle, right? And one more thing, तपाईले के भन्नुहुँदै थियो, एज कै मेन त हैन, what age, त्यही 35 को above नै हुन्छ
basically.
हजुर, मेरोमा by the time they come to me, it is 90% above 35.
Okay, so I'll come back to you. Dr. Nitish मण्डलले विशेष जुन वत्सल्य स्किम छ यसको उहाँले मिड टर्म एसेसमेन्ट गर्नुभएको हो, अनि उहाँले इनफ्याक्ट आफ्नो रिपोर्ट पनि बुझाइसक्नु भएको छ। Can you explain us, Dr. Nitish, because you did the mid-term, assessment on the Vatsalya. What are the findings in your study?
Thank you, sir. Before going to the findings, I just want to say a few things about Vatsalya scheme. What is Vatsalya about? Everybody is talking about Vatsalya. Vatsalya is, Chief Minister Health scheme, which offers 3 lakhs financial assistance to eligible couple. Eligible couples, like who are the eligible? First, we have a state examination board, like they will evaluate that those are childless couples. Childless couples, those are facing difficulties for conceiving. Ma'am has already highlighted that higher age, the complications increases. Similarly, they visit and they have exercised or utilized all sort of available healthcare facilities related to health, reproductive health, but not able to conceive. Then they examine and they referred for a Vatsalya scheme. They are providing, it is 2 cycle. In a 2 cycle, it is government is providing 1.5 lakhs, 1 cycle, first cycle, and another cycle is 1.5 to the eligible couples for having in vitro fertilization treatment, that reproductive assisted. So, and why it is very important, Madam has also highlighted that there are at least Vatsalya scheme, Amma Sashastikaran Yojana, then paid maternity and paternity leaves, similarly incentives. The whole idea is to balancing the population. We are all talking about TFR, total fertility rate. For Sikkim, it is alarming that it is 1.1, whereas desirable is 2.1. So if we not address, the whole scheme is, it's a sustainable approach to balancing the population size, composition, as well as distribution. Because overall, there are 2 important parameters, like you have fertility, one side, another is mortality. Mortality, you cannot check. At a certain point of time, population will decrease. But new population, if not added to the population, though there will be a disbalance. But later part, older population, who will take care? See, there come the Vatsalya. Vatsalya will address this. Those are having complications in natural conceiving, where Vatsalya scheme will provide the assistance. Because all we have seen, these assisted technologies are very expensive in nature, and Chief Minister's government, this Vatsalya scheme is providing financial aids to the eligible couple for conceiving. And if you see the general trend, I think Professor Sandhya ma'am has already highlighted, the structural changes are occurring in a society, like from complex, like we have this joint family system, now is changing to nuclear family system. So nobody in the if you see in a family to take care. If you see, it is not only the that birth is not taking place, but only the couple who will make their choices, whether they will give birth or not. We have this all sort of mechanism. We have a treatment, we have facilities, we have a scheme, everything. Like we are extending to as a to our beneficiaries or population for overall development. Now, the declining fertility is a general trend now. We are saying that small family is happy family. Now, we are confining this confining to the family sizes, from 2 become 1, and now both husband and wife both are working. Nobody is in the family to take care of the child, and they see, because there are other factors like if you see higher education enrollments, women are working. If you see the labor force participation in Sikkim, it has increased for last 10 years. So women almost, if you see, and the gender gap between men and female are also very narrow. Means they are now in hand to hand, side by side they are working. So such things are very crucial.
So can you tell us how many couple have benefited through this Vatsalya scheme, and what is the success rate?
Yeah, we are still, because I have given the qualitative insights, because the scheme started, as we know, in 2022, and last 3 years it is working. A good number of beneficiaries are so far availed, but we are still analyzing the fact. But the qualitative insight, definitely I will share more in the...
Right. So, Rohini ma'am, तपाईकोमा फेरि आउन चाहन्छु हैन. ART establishment under Sikkim Inspire is one of the ambitious project to address this serious issue of TFR हो नि त. So apart from that तपाईहरुले के गर्नु हुँदैछ, मतलब यसलाई अझ एड्रेस गर्नको निम्ति?
So I think 2023 March देखिको यो process start भएको, when the first letter from the Chief Secretary was sent to the Ministry of Health and Family Welfare and ICMR for support. हामीले भनिरहेको छौँ अब डेटाहरू त छ, यो NFHS 5 पनि एकदम नयाँ रिसेन्ट डेटा त होइन, 2019-21 को, सो इट्स क्वाइट ओल्ड है। तर पनि सिक्किममा अब हामीले एउटा के भन्नु, एउटा एभिडेन्स बेस्ड अप्रोच चाहिँ ल्याएको थिएनौँ। सो द गभर्मेन्ट वाज भेरी किन द्याट हामीले यसलाई चाहिँ एड्रेस गर्दाखेरि चाहिँ लाइक म्याम वाज मेन्सनिङ, अब क्लिनिकल साइड जब वेन फर्टिलिटी इज अलरेडी अ प्रब्लम, कपल्सहरू गएर ट्रिटमेन्ट गर्छ, तर यो प्रब्लमको सुरुवात त एकदमै सानो एजदेखिको, लाइफस्टाइल, योर फ्यामिली, त्यहाँदेखिको स्टार्ट हुन्छ नि। सो एउटा एकदमै एभिडेन्स बेस्ड साइन्टिफिक वेमा यसको लागि एउटा वे फरवर्ड स्ट्राटेजी पनि हुनुपर्छ गभर्मेन्टकोमा। सो हाम्रो लक्किली वी हेभ अ गभर्मेन्ट जसले चाहिँ अब कुनै कमी कमजोरी छ भने पनि त्यसलाई लुकाउनु चाहिँ खोज्दैन। वी डु वान्ट टु एड्रेस दोज ग्याप्स इन गभर्नेन्स। सो हामीले चाहिँ we approached Government of India, Ministry of Health and Family Welfare and a premier institute like ICMR to support us है। अनि सो उनीहरूले हामीलाई सपोर्ट दिन्छु भनेर हाम्रो अप्रिलमा एउटा OM पनि जारी गरेको छ गभर्मेन्ट अफ इन्डियाले थ्रु द मिनिस्ट्री अफ हेल्थ एन्ड फ्यामिली वेलफेयर। सो वी आर गेटिङ द्याट सपोर्ट फ्रम ICMR, फ्रम प्रिमियर इन्स्टिट्युट्स लाइक NIRRCH मुम्बई है। अनि उहाँहरूकै एजेसमा उहाँहरूसँग मिलेर हामीले एउटा एक्सपर्ट ग्रुप मिटिङ गरेको थियौँ 10 जुलाई 2023 जहाँ चाहिँ हाम्रो सोसियल साइन्टिस्ट म्यामहरू पनि आउनु भएको थियो, सर आउनु भएको थियो। सो वी ह्याड अ लट अफ नेसनल लेभल एक्सपर्ट्स अल्सो, IIPS, इन्डियन इन्स्टिट्युट अफ पपुलेसन साइन्सेस, अनि हाम्रो पप काउन्सिल अफ इन्डिया है। यसरी नै थुप्रै यो फिल्डमा काम गरिरहेको धेरै एक्सपर्टहरू आएर एउटा मन्थन भएको थियो गान्तोकमा। त्यो मन्थनको निचोडमा चाहिँ एउटा यो एक्सपर्ट ग्रुप कमिटीले रेकमेन्डेसन दिएको छ गभर्मेन्ट अफ सिक्किमलाई है। त्यसमा सबै सर्ट टर्म, मिड टर्म, लङ टर्म इन्टरभेन्सन्स चाहिँ के एक्टिभिटिज चाहिँ गभर्मेन्टले गर्नुपर्छ टु एड्रेस दिस इस्यु भनेर हामीलाई एउटा रेकमेन्डेसन आएको छ। सो नाउ गभर्मेन्ट अफ सिक्किम इज भेरी अर्नेस्टली ट्राइङ टु टेक स्टेप्स एज पर द रेकमेन्डेसन्स है। यसकै अन्तर्गतमा एउटा टु हेभ अ भेरी टार्गेटेड एन्ड रोबस्ट IEC mechanism, like हाम्रो young population should know the implications of TFR. हामीले जब forumsमा यसरी भन्छौँ TFR, total fertility rate of Sikkim is declining, it becomes too technical, people can't relate. इभन गाउँ बस्तीमा कुरा गर्दाखेरि पपुलेसन पुरा घट्दैछ यस्तो भन्दाखेरि एउटा जेनरल उयो त हुन्छ, तर उहाँहरूले राम्ररी बुझ्नै भएको छैन नि यसको गम्भीरता। तपाईँले ओपनिङमै भन्नुभयो 50 इयर्समा यतिजना मिलेर सेलिब्रेट गर्दैछौँ, तर 100 इयर्समा को हुन्छ? सो यो त दिस इज अ भेरी के भन्नु, एउटा एकदमै इम्पोर्टेन्ट जटिल मसला हो, तर यो जटिल मसलाको जटिलता चाहिँ हाम्रो जनताले बुझेको छ कि छैन। सो यसको लागि हाम्रो एकदमै एउटा फेरि एज अप्रोप्रिएट इन्फर्मेसन जानु पऱ्यो है। वेन एभर वी टक अबाउट TFR, फर्टिलिटी, रिप्रोडक्सन, सेक्सुअल बिहेभियरको कुरा आउँदाखेरि हामीले एज अप्रोप्रिएट मेसेजिङ गर्नुपर्ने हुन्छ। सो यसको लागि गभर्मेन्ट अफ सिक्किमले नाउ वी हेभ एन्टर्ड इन्टु अ टेक्निकल पार्टनरसिप विथ WHO। WHO हाम्रो टेक्निकल पार्टनर हो। दे आर सपोर्टिङ अस इन स्ट्राटेजाइजिङ आर IEC एन्ड अवेरनेस, जो चाहिँ हाम्रो एकदमै एज अप्रोप्रिएट हुनु पऱ्यो। सानो स्कुलको नानीलाई कस्तो खालको मेसेजिङ जानु पऱ्यो, मिड लेभलको स्कुलमा कस्तो जानु पऱ्यो, कलेज लेभलमा कस्तो जानु पऱ्यो, वेन दे मे बी जस्ट बी बिकमिङ सेक्सुअली एक्टिभ है। अनि अरू लाइफको के भन्छ वेलनेस, लाइफ स्किल्स रिलेटेड इन्फर्मेसन, यो सबै जानुको लागि चाहिँ हामीले उहाँहरूसँग मिलेर अनि हामीले स्कुल हेल्थ एन्ड वेलनेस प्रोग्रामसँग कोलाबोरेसन गरेर स्कुल हेल्थ एन्ड वेलनेस प्रोग्राममा SRH यानि कि सेक्सुअल एन्ड रिप्रोडक्टिभ हेल्थको एउटा मोड्युल नै बनाएर अब स्कुलमा इन्स्टिट्युसनलाइज गरेको छौँ। सो एभ्री ट्युजडे नाउ अल गभर्मेन्ट स्कुल्स अफ सिक्किममा चाहिँ यो स्कुल हेल्थ एन्ड वेलनेस प्रोग्रामको थ्रु यो SRH यानि कि सेक्सुअल एन्ड रिप्रोडक्टिभ हेल्थको बारेमा पनि नाउ जानकारी दिँदैछ, जो चाहिँ एउटा WHO सपोर्टेड मोड्युल हो है। यसरी नै अब हामीले इस्टाब्लिसमेन्ट अफ रिप्रोडक्टिभ युनिट त भइसकेको छ, यसको नोटिफाई भइसकेको छ रिप्रोडक्टिभ युनिट। अनि STNMमा अहिले OPD सर्भिसेस पनि अभाइलेबल छ फर इन्फर्टिलिटी कन्सल्टेसन है। अनि ट्रिटमेन्टमा जानुपर्दाखेरि लेभल 8 मा हाम्रो डाक्टर सुरेशले अगाडि नै भनिसक्नुभयो, यो लेभल 8 मा ART फेसिलिटी पाउनुको लागि हाम्रो, किनभने गभर्मेन्ट सेक्टरमा पनि यो फेसिलिटी आउनु एकदमै इम्पोर्टेन्ट छ। अहिले वत्सल्य स्किमको थ्रु धेरै बेनिफिसियरिजहरूले बेनिफिट त लिनु हुँदैछ, तर टु अवेल द्याट बेनिफिट दे आर ह्याभिङ टु गो आउटसाइड अफ द स्टेट है। त्यो चाहिँ हाम्रो घर आँगनमै होस् भनेर चाहिँ गभर्मेन्ट अफ सिक्किमले यो ART फेसिलिटी इस्टाब्लिस गर्नुको लागि लेभल 8 मा हुँदैछ। सो लेभल 8 मा फेसिलिटी त हुन्छ, तर ART फेसिलिटी इज नट जस्ट हस्पिटल, इट्स नट जस्ट कङ्क्रिट, यु हेभ टु हेभ द म्यान पावर। त्यो म्यान पावर पनि एज पर एआरटी एक्ट एन्ड रुल्स हाम्रोमा अहिले अब हेल्थको स्याङ्सन स्ट्रेन्थमा भनौँ एम्ब्रोयोलोजिस्ट जो हुन्छ धेरैवटा अब के भन्नु जब रोल्स छ नि त्यो सबै हाम्रोमा अहिले करेन्टली अभाइलेबल छैन सो यसको लागि थ्रु सिक्किम इन्सपायर्स नै गभर्मेन्ट अफ सिक्किमले एम्स आर्मी आरआर हस्पिटल हाम्रो अनि कतिवटा प्राइभेट हस्पिटलहरूसँग पनि हामीले एउटा स्टडी टुर गरेको थियौँ लास्ट इयरको अगस्टमा अनि त्यसको एज अ रिजल्ट अब एम्स आर्मी हस्पिटलसँग हामीले एमओयू पनि साइन गर्नेवाला छौँ सो यो एमओयू साइन गरेपछि चाहिँ हाम्रो डक्टर्सहरू मेडिकल स्टाफ इभन your फ्लोर म्यानेजर्स your स्टोर म्यानेजर्स है तपाईँको अकाउन्ट सेक्सनको सबैलाई जस्तो खालको ट्रेनिङ चाहिन्छ टु अपरेसनलाइज एन आइआरटी सेन्टर यसको लागि हामीलाई ट्रेनिङहरूमा चाहिँ एम्स र आर्मी हस्पिटलले हामीलाई सपोर्ट दिनुहुन्छ यसरी नै गएर अब एउटा लङ टर्म हामीले भनिरहेको छौँ कि यो टिएफआरमै चाहिँ हाम्रो एउटा सिक्किम स्पेसिफिक स्टडी पनि छैन अहिलेसम्म कुनै हाम्रोमा डेटा छैन सिक्किम स्पेसिफिक हामी एनएफएचएस डेटामा नै रिलाइ गरिरहेको छौँ है अहिलेसम्म त्यसले गर्दाखेरि चाहिँ हामीले इन कोलाबोरेसन विथ आइसिएमआर एन्ड एनआइआरसिएच अगेन अब छिट्टै एउटा स्टडी रोल आउट हुनु आँटेको छ यसको हाम्रो प्रपोजलहरू सबै सबमिट भइसकेको छ यसको अन्डर प्रोसेस छ है फाइनलाइजेसनको सो ऱ्यापिड एसेसमेन्ट अफ फर्टिलिटी ट्रेन्स डिटर्मिनेन्ट्स एन्ड preparedness of state health systems in Sikkim to address low TFR भनेर एउटा mixed method study पनि हुनु आँटेको छ सो दिस स्टडी विल बी डन इन सिक्किम एन्ड इन कोलाबोरेसन विथ आर लोकल
So यो
एक्सपर्ट्स
स्टडीले चाहिँ एउटा क्लियर पिक्चर दिन्छ with
किन
data and
why is it
statistics
yes why
and
is it
reasoning.
declining so fast and what could be the other factors social factors economic factors
Contributing
which is
factors.
contributing to
Right.
low TFR
सो आई थिङ्क सिक्किम मात्र यस्तो स्टेट होला जहाँनिर चाहिँ फ्यामिली प्लानिङको हामी बेसी कुराकानी गर्दैनौँ बिकज अब अफ द कन्सर्न्स विथ द टिएफआर राइट डक्टर सुरेश तपाईँले सोध्न चाहन्छु अघि हामीले यहाँ कुरा सुनिरहेको थियौँ कि यु नो दे हेज बिन अ भेरी सार्प डिक्लाइन नि प्रिभियसली मतलब 10 वर्षमा होइन एउटा सार्प डिक्लाइन आएको छ सो यु बिङ इन दिस लाइक यु नो फिल्ड फर सो मेनी इयर्स एज अ डक्टर होइन तपाईँले सोध्न चाहन्छु कि अघि एउटा कन्सर्न उठ्दै थियो कि एमटिपी टर्मिनेसन प्र्याक्टिसेस जुन छ होइन प्रेग्नेन्सी प्र्याक्टिसेस यो कतिको प्रिभिलेन्ट छ स्पेसली इन यङ मतलब हाम्रो यङ्स्टर्सहरूमा
अब जुन प्रश्न तपाईँले मलाई सोध्नुभयो दिस इज नट माई स्पेसियालिटी बट देयर आर छ मान्छेहरू उहाँहरू चाहिँ तर उहाँ डक्टर रुचिले भन्नुभएको जस्तो हाम्रो लोकली उहाँहरूले त्यो के भन्छ सर्भिसेस लिँदैन अन्डर द एमटिपी एक्ट हो अन्त उहाँहरू बाहिर जान्छ त्यहाँदेखि गएर इन्फेक्सन हुन्छ त्यहाँदेखि धेरै कम्प्लिकेसन्स ट्युबल ब्लक्स हो उयो भएर चाहिँ त्यहाँदेखि लेटर अन प्रेग्नेन्सीको लागि प्रब्लम हुन्छ अन्त अब एआरटी सेन्टर खोल्यो भन्दा नै इज नट गोइङ त्यो के हो एकैचोटि धमाका हुन्छ भन्ने हुँदैन अनि यहाँनिर स्टुडेन्ट्सहरू बसिरहनु भएको छ तपाईँहरू माध्यम यु आर द राइट माध्यम यु आर द राइट पिपल टु टेक द मेसेज डाउन टु द ग्रास रुट्स टु यर फ्रेन्ड्स है साथीभाइहरूलाई एन्ड अन्डरस्ट्यान्ड गरिदिनुहोस् आर्ट सेन्टर खोल्यो वा जति पनि हामीले यहाँ उयो इन्टरभिन गर्नु खोज्दैछौँ बाई भेरियस सोसियल एन्थ्रोपोलोजिकल मेथड्सले यसले चाहिँ हामीले अहिले जुन छ 1.1 त्यसमा नै हामीले राख्नु सक्यौँ हाम्रो पपुलेसनलाई भने चाहिँ हामी एटलिस्ट सेक्योर हुन्छ होला हाम्रो त आइडिया त हुन्छ एउटा फ्यामिलीमा 2.1 भन्दा बेसी नानी होस् भन्ने त्यसले त इम्प्रोभाइज हुन्छ अब जस्तो होल इन्डियामा ओन्ली 5 स्टेट्स आर अबभ द 2 उयो रेटमा जस्तो अब मणिपुर मेघालय उत्तर प्रदेश मध्य प्रदेश राजस्थान त्यस्तो तर यसमा अब टिएफआर घट्दाखेरि पनि एउटै स्टेटले मात्रै इम्प्रुभ गर्यो ओभर द पिरियड अफ टाइम त्यो चाहिँ एनएफएचएसको हो तर एनएफएचएस चाहिँ लास्ट भएको सर्वे 2021 को त्यसको बादमा कोभिड आएर त्यहाँ त्यसको बाद उयो भएको छैन सो केरलाले कसरी चाहिँ इम्प्रुभ गर्यो आई थिङ्क इट इज थिङ वी सुड कन्सिडर एन्ड स्टार्ट केस स्टडी जस्तो गर्नु पऱ्यो एन्ड हाम्रो आइडिया एट द हस्पिटल लेभल इज के भने एउटा वर्ल्ड क्लास लेभलको आइभिएफ सेन्टर गरेर अलिक सस्तो दाममा हामीले यहाँनिर ग्याङटकमै सिक्किमभित्र नै हाम्रो गरिब छ के भन्छ कपल्सहरू उहाँहरूलाई इन्टरभिन गरेर टु ब्रिङ अबाउट अ चेन्ज इन आवर टिएफआर स्टेटस
Right. So I'll just come to Dr. Ruchi, but before that I'll come to Dr. Sandhya. Dr. Sandhya, I just wanted to understand from you, होइन जस्तै तपाईँले जुन रिसर्च गर्नुभयो स्टडी गर्नुभयो नि त्यसमा बेसिकली वेन वी टक अबाउट दि इकोनोमिक स्टेटस लाइक लोवर मिडल क्लास अर मिडल क्लास अर अप्पर मिडल क्लास अर लाइक यु नो वेल टु डु फ्यामिली कुनमा चाहिँ बेसी लाइक यु नो यस्तो डिसिजन्सहरू लिँदो रहेछ नट टु मेक अ चाइल्ड अनि एउटा म तपाईँलाई के सोध्न चाहन्छु भन्दाखेरि चाहिँ आई मिन आइएम स्योर यु माइट हेभ कम अक्रस मेनी ग्याप्स इन द सिस्टम नि अब है सो गभर्मेन्टमा जुन ग्याप्स छ कस्तो कस्तो ग्याप छ जसलाई चाहिँ एड्रेस गर्नुपर्ने
बेसिकली बिफोर आई कम टु द फर्स्ट क्वेसन्स तपाईँको जुन चाहिँ सेकेन्ड क्वेसन्स whatever is happening in Sikkim, the declining fertility rate at a very rapid pace, right? One of the lowest in the state, which in the country, which is a matter of great concern. In one sentence, I would say it's an outcome of the structural change that is happening all around the world.
Like?
Everywhere it is happening. And in a small state like Sikkim, it has also been affected. Basically, हामीले 1981 मा maybe म तपाईको फर्स्ट क्वेसन अहिले दिन्छु द स्ट्रक्चरल चेन्ज हामीले हेऱ्यो भनेदेखि लेट्स टेक द थ्री इम्पोर्टेन्ट इन्डिकेटर हेल्थ एजुकेसन एन्ड द इकोनोमिक एस्पेक्ट ओके देयर हेज बीन अ म्यासिभ सोसियल ट्रान्सफर्मेसन रिलेटेड टु द्याट विथ डाटा सजेस्ट वेन वी टक अबाउट सेन्सस इन 1971 है हामी 75 मा स्टेट भएको 80.98% were the cultivator. Now it has come down to 2011. I am sure it must have further gone down now. Now 38%. So the kind of the occupational shift, this is also one of the important contributory factor. You know, when agricultural society ma, obviously they need the labor. You need to definitely the family size is more. Yeah, example mero Branne, one of the international students from Eritrea, he was telling ki he's there and unarko agrarian economy and still the 5 is the average children. And he also has 3 children right now. Okay, so major occupational shift, diversification towards the secondary and tertiary sector, it is one of the major structural change that is affecting. And उहाँहरूले नै सेम भन्छ कि एक त इकोनोमी सर्भाइभल नानीहरूलाई हायर एस्पिरेसन हाई कस्ट अफ एजुकेसन हाई ड्रिम्स होइन दिस आई फाउन्ड not only restricted to the so-called upper middle class or the educated group, but I have seen when we spoke to the somebody who is working as a daily wage laborer, unarko perception kya aba same bhaisakyo aba त्यो thought process has been strongly embedded in the Sikkimese society अर्को कुरो तपाईलाई हेरौँ जुन चाहिँ स्ट्रक्चरल चेन्जमा हामीले हेर्यो भने लिटरेसी रेट हामीले जब 1981 immediately after the Sikkim's merger, incorporation with India, female literacy rate was 18.24. Now, 2011, it has come, went up to 73.42%. Very recently, when I was dealing with other high-level committee ko data, literacy rate is all about 80, 89, like that. That thing has not yet been come out. So this literacy rate has impacted the entire structure. And it is not only the literacy of reading, writing, just knowing the basic of the thing. Higher education ma हामीले हेर्यो भने quite interestingly मैले हेर्दै थिएँ कि यो higher education मा all India higher educational level को 1921 को data मा मैले हेर्दै थिएँ there has been a massive increase of girls and the boys who are enrolled in the higher education. To 2015-16 ma, when we compare it with the northeastern states, Sikkim scenario was not good. Our major reproductive age, 18 to 23, they are now in the higher education, and according to that All India Survey of the Higher Education, Sikkim has the highest gross enrollment ratio, both in terms of the girls and boys among the northeastern state. So, yahaneri hamro major, जुन चाहिँ fertile stage को नानीहरू छ नि, त अहिले आएपछि हाम्रो I can say I have many scholars here. 25-6 they complete the masters. I have my PhD scholar who are almost above 32. Oh, ma'am, job paunu paryo. So that higher aspiration, that the kind of structural change, it has impacted everyone. So I think I'm very happy that the young student, UG students and master students are there, and I think tomorrow they'll become the parents. So I think they are the right persons to be sensitized, and for that that is also the thing. Like एउटा स्टडी म तपाईहरुलाई भन्नु चाहन्छु बीना भासिन एन्थ्रोपोलोजिस्ट न she made a very interesting study in 81 to 83. Okay, त उहाँको स्टडीमा के छ भन्दाखेरि हाई फर्टिलिटी रेट अफ 3.1 वाज रिलेटेड टु लो एजुकेसनल लेभल. सो जति हामी एजुकेसनल लेभल हाम्रोमा बढ्दै जान्छ, अहिले हायर एजुकेसनमा हाम्रोमा म्यासिभ इन्क्रिज छ. We have a lot of university colleges and people are also sending out also, which has become a trend. Okay, त्यसले गर्दा obviously हाम्रो enhanced age of marriage, जति enhanced age of marriage and education हुन्छ त्यति rational thinking and rational in the family planning also. And obviously they don't want to have more than one or two going through all the pregnancy, the kind of the process and all. Okay, sir. अनि उहाँले भन्नुहुँदै थियो. अनि मलाई एउटा कुरो लाग्छ कि सर, when we went to the village, they said कि किन यस्तो कम्ती भयो भन्दा many आशा वर्कर्स, म्याम यो चाहिँ सिक्किममा जुन चाहिँ एग्रेसिभ एडभोकेसी अफ द फ्यामिली प्लानिङ भयो त्यसको, बिकज एभ्रिथिङ इम्प्याक्ट यु क्यान नेभर एक्सेस इमिडिएटली,
बिकज सिक्किम टेक्स एभ्री इम्प्लिमेन्टेसन भेरी
सिरियसली. एन्ड उहाँले भन्नुहुँदै थियो जब सिक्किममा भयो त्यसको इम्प्याक्ट चाहिँ नाउ यु क्यान सी इट नाउ, होइन. अन्त उहाँहरूले भन्नु, अनि मैले वेन आई वाज इन्ट्रोस्पेक्टिङ अन द डेटा अफ बिना भाषण 3.1 to having the low literacy level, that means hamro lage in general whether that strong advocacy of family planning, whether it was necessary or not.
Right.
81 83 ma pani 3.1 for those families who have the low literacy level. So they already started. And जुन चाहिँ एउटा एकदमै स्ट्रङ मेसेज गयो होइन. म पहिले एउटा हेर्दै थिएँ स्कुटरको एउटा नेम प्लेटमा पनि हम दो हमारे दो, एउटा सेन्ससको प्लेटमा पनि हम दो हमारे दो. सो इट हेज बिन स्ट्रङली इम्बेडेड इन द माइन्ड अफ द पिपल. अनि अब गाउँमा गएर मान्छेहरूले चाहिँ हामीलाई के भन्दै थियो, प्लानिङ फर द थर्ड बेबी इज समथिङ स्टिग्मेटाइजेसन म्याम. दे विल विस्पर, ओ शी इज ह्याभिङ द थर्ड बेबी, सो नो बडी वान्ट्स टु टेक द्याट. So that is I think.
And we never thought कि यसको repercussion चाहिँ long term TFR ले affect हुन्छ.
Yes sir. अनि yes.
Yeah. So
त्यति बेलाको जो हम दो हमारे दो को एडभोकेसी चलेको थियो, द्याट वाज लुकिङ एट द इन्डियन सिनारियो, बिकज इन्डिया वाज गोइङ टु बी वान अफ द मोस्ट पपुलस कन्ट्रिज इन द वर्ल्ड, बट द्याट वाज नट क्वान्टिफाएबल इन द सीन अफ सिक्किम, राइट. सो इन्डियाको रुल्सहरू जे छ अब एज अ होल, आई विल जस्ट एड वान स्मल फ्याक्ट. इन्डिया स्टिल बिङ द मोस्ट पपुलस कन्ट्री एट 1.48 बिलियन पपुलेसन छ. Even India's TFR has also come down to less than 2.1. It has come to 1.9, which is again not a replaceable, level of TFR, But anyways, coming back to ma'am, I just wanted to add that ki teti pela whatever the rules and regulations hamile as a country, Indian country hamile pancha, it is not applicable directly to our state per se,
Right.
Similar observation I can also
Yes.
add. Because what Madam has, Professor Sandhya ma'am also said, ma'am was also highlighting, like excessive use of contraceptive.
Easy access
Easy
to
access to. Even if you see the overall goal of Government of India, like to reduce the overall fertility rate. Now it is we have already reached to that desired level, that is 2.1. If we consider the mortality aspects also, many states, like we have only 4 states are above the replacement level. And overall states and union territories, if you see, the fertility level has come down. The major concern is the Sikkim. We are having lowest. So lowest. Yes, lowest in the world. And another important part, like if we have easy access to the contraceptive, then because previously I also said, choice is yours. Choice is yours. Now ma'am has already hum do hamare do, but now it's become hum do hamare ek. Majority of the families, when in case of Vatsalya scheme, when you approach to the rural areas, we talk to the women, eligible couples, that whether you want to extend your families. They said, first we asked that do you think large family are beneficial? They said yes, beneficial. These things are very beneficial. But would you extend the family? Well, say no, we are happy with one.
So because what I think भन्दाखेरि चाहिँ because the cost of living is very high. दुईटा नानी पढाउनु, तीनटा नानी पढाउनु is like very, it comes very costly, So I think this is one of the contributing factors.
because of the higher living standards.
Right,
They
right,
desire
right,
to have a higher living standard. Cost of education is more. And they see this child now with the responsibilities. It is like they bring to the world, then you have to provide the education, healthcare facilities, such things also that. And parents are the need to facilitate. So such factors are now going to affect at the community level, at the population level. And Sikkim, like implementation of these, say, national health policies. Now, why that, which is, you have already said, Sikkim is very serious about implementing the policies at the ground level. So as a manifestation, we can say we have these adverse consequences.
Right. Okay, yes ma'am.
Just to supplement what he talked about the contraceptives, sir, I can see the data. If you just see the NFHS 4 to NFHS 5, it has increased from 47, the rate of contraceptive prevalence rate. 47, it has gone up to 69 within just a few years, okay? And when we try to see the empirical finding, and this was almost all the health workers, then I asked them, isn't there any limitations? Having baby or not to have the baby is their choice. This is the fundamental right. And what they talk about is, even though they do not come to the primary health center for the contraceptive, mass availability in the town. Going to Siliguri is not a matter of, not a big problem, okay? So this is what they said, this is also one of the reason. And somewhere, of course, somebody raised the issues also, even some of the area, living relations. This also is coming as an emerging issues.
Right. So हामी जब सिलगढी जान्छौँ होइन, हामी बाटोमा देख्ने गर्दछौँ right from सालुगढा that so many IVF centers have come up. अनि मलाई के लाग्छ भन्दाखेरि specifically these IVF centers have not established to address the TFR issue of the West Bengal people, but I think the market what they are targeting is the Sikkim होइन, because I don't know काहीँ न काहीँ गएर commercialize भएको छ भन्ने, and Vatsalya scheme is like one of the factors which in fact they are setting up so tell me कतिको कमर्सियल भएको छ, किनभने सक्सेस रेट कतिको राम्रो छ अथवा के चाहिँ गर्न सक्छ अब कमर्सियलाइजेसन?
तपाईँको यो भन्नुभन्दा अगाडि I want to tell through this forum to the public that many people उनीहरूलाई लाग्छ कि हामी अब IVF डक्टरकोमा गयो भने चाहिँ हामीलाई IVF नै गरिदिन्छ भनेर. That may be applicable to many places. I cannot comment on that. But I personally want to tell that many couples' problems can be solved by simple medications, correcting hormonal imbalances, correcting infections, those small level you can conceive. Not necessary you have to go. IVF is the last resort, हामीले अहिले जस्तो सरले भन्नुहुँदै थियो कि हामीले ART सेन्टर जुन चाहिँ हामी अब गभर्मेन्टले यस्तो राम्रो इनिसिएटिभ लिएर जुन चाहिँ गर्नु हुँदैछ, अब इट इज नट कि हामीले ART सेन्टर खोल्ने बित्तिकै जस्तो सरले भन्नुभयो नि उयो हुन्छ भनेर, त्यस्तो होइन. हामीले अब ट्राइङ टु हेल्प, ट्राइङ टु मेक अ प्लेस, सेफ प्लेस वेयर कपल्स क्यान कम एन्ड सिक हेल्प. द्याट इज वान थिङ. Another thing, but couple has to get over that hitch of coming to seek help also. That's also another thing. Because aile pani त्यो stigma is attached, to going to a doctor, हामीले IVF garako. They don't want people to know that. That's one reason why people go to Siliguri or anywhere else. Because यहाँको local मान्छेले थाहा नपाओस् बाहिर ट्रिटमेन्ट गर्नु के को लागि गयो. That is also there.
Attached to this लिएर.
हजुर? Oh yes, very much. Very much. They're embarrassed to, Costco problem. So all these things, that's what I feel is we as a community in general, as a whole, like it is not a, it's not a stigma to be think about. Like we have mental health issues. People don't even talk about mental health issues. Who wants to tell afno, family में यस्तो छ? But it is त्यसरी नसोचेर जस्तो any other health problem भएको जस्तै, like हामीले यसलाई एड्रेस गर्यो भने, timely help लियो भने, without that issue, then I think we can have a much better success rate. One for the treatment part. अब तपाईले जुन चाहिँ सोध्नु हुँदैछ IVF को success rate. अब what I know, what I have been taught, what I have read, what I have heard, best of उयो like it because IVF हामीले धेरै कारणले गरिन्छ है. Either it can be the egg problem, oocyte जुन चाहिँ भन्छ. Either it can be the sperm problem, or it can be the tubal factor, there are many reasons. So sabai agar if it is in the optimum सबै हामीले अब बाटेर राख्यो भने if सबैमा optimum हेऱ्यो भने tubal problem is one जसमा IVF को success rate सबसे बेसी हुन्छ because we don't need tubes in that case. We can directly bypass the role of a tube and then do an IVF. 40% I would say. Many centers go around telling we have 80% success rate, 90% success rate. They may be talking about a certain batch. When we do an IVF, treatment, many people do it in batches of 10 people. Suppose त्यो 10 people ma I'm 80 8 जना भयो भने हाम्रो success rate is 80%. But when you collect the data of the entire year and then you make, it is not above 40% actually per se. The success rate सोध्नु भयो भने चाहिँ.
Right. So I think yes, ma'am.
Okay, so just supplementing to what ma'am talked about, and I think responding to that query, sir, what you exactly told me about the gaps, whatever the initiative state has taken about. What I would say is that, whatever the government of Sikkim is taking the initiative, it is a commendable initiative that we have to acknowledge about that, okay? However, personally, as a social scientist, going through all the literature or whatever structural changes that is happening, the social transformation at the wider scale, the way it is rapidly impacting the Sikkimese, Sikkim is very fast in adapting all those things, okay? So going by that, I think Vatsalya scheme, wonderful scheme. IVF is a good initiative. I think government of Sikkim has to go beyond in addressing the socio-economic factors and sensitize in a massive way, because somehow I feel infertility could be one of the factor which I don't want to talk about because experts are here. But personally, when I went to the village, I found a lot of socio-economic factor. Even the changing, even the cultural norms and all. So in addressing that, I think not only monetary benefit would help, sir. I was talking to one of the scholars in Japan. They said they have a good provision of handsomely paying the probable parents, but that has not worked there. So only material benefit, only this thing, but that willingness, the voluntariness to plan for more baby, okay, to have more baby, despite the fact that you might marry on, say, a 27-year scholar marry, then doesn't want to have baby. Now the surrogacy or reproductive things also has come in a big way, sir. So these are the major concerns. So what I feel that, addressing all
Approach
those social
should be
approach should be
different.
Yeah.
Okay, we have students, participating students from colleges, we have from university, and we'll take a quick questions from queries from our I think we can start with Roshnila.
So my question is to Dr. Ruchi. So motherhood, parenthood is, I think, something which is like a personal choice, and in today's era where for everyone, I think settling down is not just settling down, having a family, getting married. For some women especially, settling down is also securing a stable career for themselves. So, and of course, the problem of declining TFR is such a grave concern for the state. But having said that, we cannot impose people, to start getting married, start having babies. So, what are the alternatives or solutions available for women who want to preserve the fertility without compromising their career aspirations?
See, in Sikkim's context, it is very important because Sikkim has a women workforce of 58% as compared to 27% of overall India, right? When we talk about fertility preservation, actually it was started for cancer patients prior to them undergoing chemotherapy, or radiotherapy. Then there was something about, oocyte preservation or ovarian tissue preservation. Then they could go for a, treatment. Because post-treatment, the ovaries would then finish, sort of like that. But this same can be applied for women who opt for late marriage, who opt for late child because of career. But it is not an alternative. It is just an option that can be given for oocyte, preservation. Because whatever said and done, oocyte preservation is sort of like, okay, you have something to fall back on if and when you decide to have a baby. But let's not look at it, it comes with its, conditions apply, right? So it is not actually an alternative for marrying late or planning baby late, but just as an option, it can be kept. Yeah.
One more question. So, like, then I think there are a lot of also narratives being built on, I think, what we call as egg preservation.
Yeah.
Egg preservation.
Oocyte preservation.
Yes, oocyte preservation.
Actually, in technical, egg preservation, oocyte preservation is
It's
the same thing. Yeah,
Okay.
yeah, yeah.
Thank you.
So my question is to Dr. Ruchi. Ma'am, if someone is in their late 20s and unmarried, and they might have tendencies to build up fertility related issues in future, they are totally unaware of it. And I'm asking for both the sexes. So do you think in medical field there are any ways to detect it at earlier stages, or it is just restricted to having precautions during sex or having good food habit?
You're talking about evaluation of fertility
Yes,
in the late
related
20s
issues.
if you want to.
Yes,
Yes, of
yes.
course you can come and do that.
Like there are screening methods or something?
Yes, there are screening methods, because what we are finding is that we tend to kind of accept that late 20s women, I'm just right now, or girls, whatever, we late 20s ma ta egg huncha, cha, that is what our general, thinking is. But actually it is not like that. Our, the more generations, are coming up, now we are seeing a trend for early premature ovarian failure, So it can happen. I have seen, not here, outside, but somebody having a premature ovarian failure as early as 26, right? I have seen 28 in Sikkim, that was post-tuberculosis. The lady has no idea that her eggs are already finished, because she had tuberculosis, which may or may not be again pulmonary, because हामीले छातीको TB चाहिँ थाहा पाउँछ नि. Genital tuberculosis presents as infertility later in life, and TB, I think, sir, is very prevalent in our state, sir. And so it can present like that. So if anybody wants to have a general screening, of course they can come and have that, right? And
you,
for
ma'am.
men, it's very simple. Your sperm gets tasted. That's about it. But of course, smoking, alcohol, those things will affect it.
In this context, I just want to inform you all. See, the jamana badlyo, infectious diseases have come down, right? So non-communicable disease is rampant. अहिले जो 40 years and above हामीले जुन diabetes देख्यौँ, hypertension देख्यौँ, अहिले it is coming down right down to 25 years को एजमा young adults from colleges walking in and they are in disbelief. It's basically bad lifestyle. So times are changing, so you have to change your lifestyle. Especially collegesहरू जाँदाखेरि late nights and पढेर बस्छ, अल्सर बोकेर आउँछ, कुनै के ल्याउँछ, त्यहाँदेखि junk food, then food supplements, all that is creating the problem, and which you will suffer later. In one term, यही infertility मा.
So we know these are diagnostic tools are available for infertility or fertility diagnosis, but the problem is the major population are not aware of. Because there, I also emphasized before that facilities are available. The boon will reach to the population unless you not utilize it. Somebody has to come, or same, we need to go approach them. Yes, we have these facilities, come and utilize. Then effective implementation of the policies that which are actually meant for. So those things will be, population can be benefited and problem will be addressed.
How does decline in fertility affect economic growth of state?
It very much affects the economy of the state. See, this, because when there is a decline in fertility, we are not just talking about a population going down. See, when we are, हामीले जब overall population हेर्छ, हाम्रो healthcare facility improve हुन्छ, what happens is हाम्रो the age, sir, death को जुन चाहिँ age है, simple term मा, अब that gets increased. The older generation, older population of older generation is increasing, but the population which actually is the workforce, that will decrease. You understand? It will create more economic burden. It will create more social welfare program burden, because हाम्रो working population त ultimately घट्दै जान्छ नि. But our elder generations, older generation who are dependable population, उहाँहरूको बढ्छ because of better healthcare, facilities and all that. हाम्रो अब the age at which somebody, an average age of death, होइन sir, like that is increasing. You're getting me? I don't, life expectancy, yes, please.
See, say for example, today 100 births taken place, okay? And after 20 years, this 100 population will add to the population and they will earn economically they earn, and they contribute economically, right? Now, these 100 individual, if tomorrow it's become 50, then what will happen? Income they generate, say for example, 1 lakh after 20 years. So this 50 will become half. So that way, the population is going to affect, because labor for participation is very important. Because see, these individuals who is going to contribute not only the families, they will also going to contribute the state, contribute to the nation, to the society. Even later part, what will happen, you will not have people to take care of the older generations. So today you have, say for example, 1 lakh population who are the age group of 50 years. So after 10 years, they will be 60. Then they will rely on us for their common. So after 60, you cannot ask the people to go and work 40 years. So these new births taken place, and they will, after 30 years, they will replace that. So in that way, the cycle will continue. Yes, ma'am.
Please be seated. I have once seen the CBSE class 10 geography, where there is a, population pyramid kind of the thing. So usually in our, the earlier Indian scenario, the population, the productive population group, 15 to 59, is the most population, productive age group. So the base was larger, and that old people, who were surviving, it was less. Now, gradually this population pyramid is changing. When we see the Japan, in case of Japan, because of the increase in the life expectancy of the elderly people, because of good medical avenues, good medical facilities, the people, those who are elderly people living, that is much bigger than the base in Japan. So what is happening here? The dependency rate become very adverse. That means there are very few working people, and especially when there are old people, the life expectancy is more, people are surviving for more years, then often, obviously they need more social welfare measure, and it can obviously affect the income of the country also. So because of that dependency ratio will be, it will become much more adverse.
Hello everyone. So my question is to Dr. Ruchi regarding the infertility rate. I guess what about the question of surrogacy? Is it a good option for people who are unable to, who are infertile in a way or two? We call it in a sense infertile or incompetent, right? So is that a good option? Because commercial surrogacy is banned, I guess, in India since 2024, and there is a way we can do surrogation without material benefits, right? So I guess, is there option? Is that an option for Sikkim? And second question is mostly for, I guess, everyone out here, because since we are talking about conceptual thing about infertility, right? So what happens is we are also talking about in a way or two about feminism out here, because we are saying that women have become they have become much more independent, and there's a change in the structure which we talked about, as ma'am talked about just now, right? So how can we bring about a synthesis between traditional family standards, also the role that women play in the society as well as the state, and also be the feminism? Because I don't think so a youth of our age wants to compromise on both, right? So how can we be how can we bring a synthesis? Because it's like a thesis and an antithesis, right? Right now that is happening. So let's bring a synthesis and implement in the state of Sikkim. So how is it possible? So yeah.
So first question can be asked by Ruchi.
Yeah, sure.
Yeah. Regarding surrogacy, commercial surrogacy has been banned. Now it is supposed to be altruistic surrogacy, where no money is transferred or whatever. See, there have been the people who can avail surrogacy, our government of India has put in very set, rigid rules. Okay, only 4, 5. There are 4, 5 conditions in which you can avail surrogacy. There is a board you have to go through. Each state has a board. Not all the states of India has so far, come up with the board. Sikkim has a board. West Bengal has a board. But they have to put up, like previously, in simple terms, I'll tell you, before this act was, put into place, doctor used to decide that my couple or my, patient, they require surrogacy. A doctor used to decide, used to get in touch with the agency who provides the surrogate. It was like that. Now it is different. A doctor can suggest that yes, my couple requires surrogacy and has to give the reason exactly why my couple requires surrogacy. That file has to go through the medical board who will analyze the whole thing and give approval. No, it is not the doctor who is now deciding. Doctor is only suggesting, but it is the board who is deciding, who will give the let's say the okay permission sort of for the couple to undergo surrogacy. It's not as easy as it used to be before. That is there. I don't know if I've answered your question correctly or appropriately or whatever, but that is how it is just now.
Anyway, thank you for very interesting and theoretically loaded questions also. You talk about the feminism. You talk about the assertion of the women, like, the right of the assertion of the women. And I think that is a fundamental right. As a woman, I also would say. Just because our society was too patriarchal, not only our society, the pan-India phenomena, even in the global north-south, whatever we talk about, that patriarchy still exists. Okay, so the assertion of the women right is not basically denying that I don't want to, bear the child, or, I don't want to have it, coming out of all these social responsibility. But actually what is happening in our society is, being the patriarch, despite the fact that we are educated, I'm working in the university as a professor. My colleague is a wife of the DCP. She is also the professor here. The gender work still remains. Gender division of the labor still, I cannot say, okay, I'm single, but I haven't seen, those who are married, despite the fact that they are class 1 officer, okay, the man can do that. And I think having children, I think they can plan it. A proper sensitization is necessary. What is important is somehow that patriarchal mindset has to be changed, that parenting of the child is not only the sole responsibility of the women. So my clarion call to all the young, persons like you and all, please try to socialize yourself in a gender-friendly atmosphere, whether it is a cooking, whether it is a co-parenting, it is not the man and the women domain. So this is where I think we can take the balance. If women get the support at home, if your careers are not affected, I'm sure with the proper kind of proper discussion between the husband and wife, I think, and if the parenting from both the husband and wife is there, that load is not there on the women, I'm sure they will. But the rational thinking, just whether I want to plan a baby or not, that also, I would say that a right also should be given to the women. So I hope, so that gender socialization, guys, you please begin to have that more egalitarian kind of socializations now. Thank you.
So, even while talking about infertility, I'm very happy that the first question we had from the student there, she said that for both the sexes, right? So the burden of fertility also, I don't know where this notion comes up from. Both the husband and wife are trying to have a child and they are not successful. But everybody just thinks that it's the burden of wife's problem. Why? It's 50-50, right, role? No? So, yes.
Men are responsible. It is the men's
It's proven, there is data. It's evidence-backed that the burden is not 100% on the wife. So that is also there. We must always keep that in mind. Yeah, the society is consisting of both male and female. Both the sexes have equal responsibilities and equal roles. And also that's why while we are trying to address थ्रु गभर्मेन्ट अफ सिक्किम प्रोग्राम. सो यो SRH मैले अघि पनि मेन्सन गरेँ, सेक्सुअल एन्ड रिप्रोडक्टिभ हेल्थ. सो दिस वी आर ट्राइङ टु इन्स्टिट्युसनलाइज इन द स्कुल्स. सो स्कुल भनेपछि त खालि केटी नानीलाई मात्रै यो सेक्सुअल एन्ड रिप्रोडक्टिभ हेल्थको बारेमा जानकारी दिएर इट्स नट गोइङ टु सल्भ द प्रब्लम. सो करेक्ट इन्फर्मेसन, एकदमै टार्गेटेड इन्फर्मेसन सुड बी अभाइलेबल फर बोथ आवर केटा नानी, केटी नानी, so that when they grow up, they are able to take that informed decision. है अनि just because the population is shrinking, I don't think women of Sikkim should stop going to school, stop going to universities, stop chasing their dreams. It's not going to happen also. So we must also find out ways and means as a government also, and the government is trying to do that, by the way. So we must find a balance in supporting our women so that we can excel also, we can have the both. हैन, करियर पनि हुन सकोस्, साथसाथैमा फ्यामिली लाइफ पनि, if I want, I have that conducive environment, socially, economically, not just in terms of medication and treatment. So that we are trying to do.
This scenario is same. Like when we went to the villages, we talked to the women and as well as the men. Most of them are working. And when you ask them what you suggest, that how we can balance, they said somebody should be there at home to take care of the babies. And then something came to mind, because if we install certain or establish certain daycare centers, like even we are thinking in a qualitative point of view, like those things definitely address the needs, balancing point of view. So these are like somewhere we able to address, because we cannot ask, as ma'am has already said, that women definitely because they go, yes, education, higher education, they are working. But what ma'am said, we should not stop women to go for their work. At the same time, we have to come up with certain alternatives.
Right. So we are running terribly out of time. So I just would like to end this conversation. Ani Dr. Suresh ko bata चाहिँ ending note लिन चाहन्छु. I think there used to be a time when our forefathers, grandparents used to bless us during Dasai Tika. नानीले डाँडा काँडा ढाकोस्. Nowadays हामी त्यो सुन्दैनौँ. Like, you know, I don't know, I mean, यसको के reason हुन सक्छ है. So what is your, like, you know, closing remark आजको जुन डिस्कसनबाट, what is the approach we need to further take up?
As far as I'm concerned, I think it is a very daunting task, because it comes to an individual person's perceptions, ideas, dreams, which no one can intervene at a personal level. So I think I see education and provisions of good life where we can evolve with a few, policies and grants and all that, so that a person, a male or a female, can still pursue their life, at the same time have children for the future generation. But I still feel it is a daunting task.
Absolutely. So आज एउटा कुरो चाहिँ के क्लियर भयो भन्दाखेरि चाहिँ there is no single solution to it, right? Because it's a very multi-sectoral अनि inclusive अनि sustained approach हुनुपर्छ भन्ने कुरो चाहिँ आज हामीले बुझ्यौँ नि त. So I just would like to say, like, let the discussion does not end here, right? I mean, let it be a beginning for more research and for more better policy and increased awareness, and above all a collective will to address the demographic future of our state with, I think, more sensitivity and foresight. That is what we needed, right? So thank you so much all the panelists. अनि हामीले यो एकदमै यो एक्सरसाइज गऱ्यौँ है तपाईहरुलाई अवेयर गर्नका निम्ति. हामीलाई थाहा छैन कस्तो इम्प्याक्ट हुन्छ, तर यो हामी एउटा डिजिटल रेकर्ड राख्न चाहन्छौँ that we are serious in addressing the declining TFR in the state of Sikkim. And with the entire team of Sikkim Chronicle, the technical support, this is Nirmal saying goodbye and thanks for watching. र हामी in fact अन्य subject अनि अन्य issues which concerns with the state of Sikkim, which concerns with our population, यो पनि हामी तपाईहरुमाझ लिएर आउने छौं. Until then, thank you so much. See you next Sunday. Bye bye.